Hello, I'm Dr. Igor Simonov, and today I will continue explanation how I use the pulse map method and the pulse guided acupuncture for treat different cases with acupuncture. Today I will explain how to treat the tinnitus, and we will use the difficulty number 75 of Nanjing, which states that when east is full and west is deficient, we need to unify north and disperse south. Okay, first I will explain something about Wu Xing theory, which we use in the pulse guided acupuncture. So here we have the say like the chart Wu Xing. He's Wu Xing. Wu Xing explains that it's the 5 movements. So different segments, 1, 2, 3, 4, and the 5th movement in the center, which situated between the sky and the earth, and these two persons walking to the opposite sides, showing the movement. So what Chinese thought about the Wu Xing, they say that in the south, in the top, is the fire. In the north, in the bottom, is water. The west is the metal, and the east is the wood. In the middle, in the center, is the earth. So I had the patient. Here is the pulse map of the patient who had the tinnitus after ear infection, very strong noise in his right ear during couple of months. So what we can see, I will remind again, here we have the meridians: lung, heart, pancreas, liver, right and left kidney, large, small intestine, stomach, gallbladder, triple womb, sanjiao, and the urinary bladder. So what we can see that little bit excess in the lung, which is compensated by deficiency of the large intestine, and it belongs to the movement of the fire, in this case, in the level of the heart fire. Heart is little bit deficient, and the movement of the metal, deepness of the lung. The pancreas, little bit excessive, and movement of the same deepness like the liver, so movement of the wood. And the liver, a little bit deficient, but compensated by the gallbladder. Anyway, here we have the liver movement of the earth and the kidneys. Here we have the large intestine, small intestine, excess in the stomach meridian, gallbladder, and the sanjiao and the urinary bladder. So according to this pulse map, we can say that the lung is a little bit in excess, and it is a fire, lung fire. Heart is a little bit deficient, movement of metal. Pancreas, movement of the wood in excess. So spleen, pancreas, we leave these red circles around the excessive organs. So it is the wood, and here is the kidney. So how we should provide the treatment according to difficulty 75. So if the wood is in excess, east in excess, and the west is in deficiency, heart and deficiency, spleen in excess. We need tonify north, kidney, and disperse the heart. So how we can do it? What we can do actually is very interesting rule, because in this case we can use just one point according to this rule. And what point we use? We will use the point of meridian of the heart meridian. We will use the point of metal. Why is that? First, we will tonify the north. We will tonify kidney, because by this rule, in this chart, the mother of kidney is, mother of water is the metal. So we will tonify heart. After that, after a few minutes, what we will do, we can check the pulse, and we will disperse the same point, metal point of the heart meridian. So what it will do, heart here, the metal, is actually sun of the fire in this chart. So what it indicates, that dispersing the sun will disperse the fire. So first, as the Nanjing indicates, first we need tonify, and after we need disperse. So we use just one point in this case, and as I did, and a few minutes later during the treatment, patient found that his tinnitus decreased and practically disappeared. So he had the very, very little noise comparing to a very strong sound in his right ear. So patient is still following to come to the treatment, but this treatment indicates how effective it is by the difficulties 75 of Nanjing. Thank you.